Are you a man and you are already 40 years and above? Or a woman, you have a husband or brothers who are already 40 years and above? Then you need to pay attention to this video because it is specially made with you in mind. And why does it concern you? It's because of the information that I'm about to reveal to you in this video. Do you know that in 2022 alone, over 80,000 new cases of prostate cancer were discovered in Africa? And over 11,000 cases of deaths were also recorded. That's a whooping number, of course. All right. So because of the enormity of this problem, that is why we want to talk about it. So I urge you to pay attention to the end of this video. Okay, having known that, before we go into talking about prostate cancer and whatever, we first of all want to know what the prostate is. The prostate is a walnut-sized gland that is situated below the urinary bladder. So under the urinary bladder, as you are entering into the urethra, the passageway to the penis, you have the prostate gland situated there. And what work does it do? The prostate gland secretes nutrient-rich alkaline seminal fluid that help to nourish the sperm and also assist in ejaculation by forcefully projecting this fluid through the urethra. So its work is just to make sure that the sperm is healthy for reproduction. All right. Having known this, what is prostate cancer? Prostate cancer is simply the malignancy of the glandular cells of the prostate. Or simply put, it is an unusual growth of the cells of the prostate gland. So when the cells of the prostate gland begin to increase in size, or when the cell begin to grow faster than it used to be, then there is cancer. But this will eventually bring about tumor and then get to the stage of cancer. All right, how do you know that, or what will make you to suspect that cancer is already in the process or has already been established? Number one is that the individual might start having frequent urination, especially at night. And the second sign is that the individual might also have difficulty passing urine. The third one is that the urine flow will become weaker. Ordinarily, as a male, when you hold your penis to urinate, the urine becomes very fast and projected, projectile urine. But in this case, it now slows down. Another symptom is that there could be blood in your urine or in your semen, and this usually happens in the advanced stage. Then there could also be pain in the bones in the advanced stage. All right, before we go ahead to begin to talk about the actual causes and why cancer happens or in the prostate, I want you to like this video if you're already finding it interesting. If you are not subscribed to this channel, please hit the subscribe button and make sure that you are subscribed to this channel. And make sure that every time you watch our videos, you share it with your friends. All right, thank you for taking that action. So let's go ahead now. Why are there prostate cancer? What are the possible causes? Number one is because of genetic changes. Genetic changes happen, especially within the DNA of the prostate cells. There could be mutation, and this mutation could be inherited from your parents. And so when you have BRCA2 gene mutation inherited from your parents, this could make it impossible or difficult for your cells, damaged cells, to heal properly. And if damaged cells are not healed properly, they could give rise to cancer. And in this case, it could even be that you, as a person, you are living normal life. You are not smoking, you are not drinking, you are not doing anything, you are not taking the kind of things we say can cause cancer in this case. You're just living your normal life, but you still have cancer because you inherited the BRCA2 gene mutation from your parent. The second reason why there could be a prostate cancer is because of family history and hereditary risk. If within your family somebody has already had it, one of your relatives, whether your father, whether your brother, whether your uncles have had it, the chances of you having it becomes times 4. So at that point, you must become very careful. If you know that you have such history, you should begin to go for screening once you're already 40 or 45. Don't wait until you begin to see signs. Then the next reason why there could also be cancer of the prostate because of aging. Yes, prostate cancer is associated with age. The older you become, the more the risk of developing it. Before 40 years, you can barely hear about prostate cancer. But at 50 and above, the risk increases. However, most of the cases that are diagnosed after 65 years old. So in other words, once you are below 40 years, you do not have the fear of cancer at all because people hardly come up with cancer at that age. But when you are 50, you should begin to get your mind prepared because there is the increased risk now of you developing it. But at 65, you stand a big chance because most of those cases we already have now were diagnosed at 65 years. Then the next reason why you could also have it is as a result of hormonal and biological factors. Yes, the prostate gland depends on the male hormone, androgen, especially the testosterone, to maintain its growth and normal functioning. However, if there is mutation, the same testosterone could actually aid the prostate gland to begin to grow abnormally. So the factor that's actually responsible there is that mutation that could drive the hormone to push it to become what it should be, to become cancerous. Then the next reason why you could also have it is because of race and ethnicity. Yes, Africans stand higher risk of developing prostate cancer, especially the aggressive type. We said that prostate cancer develops slowly. That is the good news about prostate cancer. It develops slowly, and when you detect it early enough, it is easily treatable. But the aggressive type does not care. So as an African, you stand the risk of getting the aggressive cancer that comes within a few months, and before you know it, there's already death rates and whatever. So we all need to be careful as Africans. But the next reason why there could also be cancer is because of your lifestyle factors. If you are smoking or you are taking tobacco, all these contain a lot of chemicals, toxic chemicals that can destroy your system, that can bring mutation and cause prostate cancer to happen. Then if you are also taking processed meat and high fatty food, you also stand a chance of developing prostate cancer. In addition to that, if your lifestyle is sedentary lifestyle, where you go to offices, you sit down in front of your computer for the whole day, or you are the one writing receipts for your company, and you are always there handling booklets, and you barely stand up to do anything, no exercise, no walking about, you could also push yourself to become a prostate cancer patient. Then the number 7 reason is because of environmental factors. Yes, environmental factor. These include excessive exposure or prolonged exposure to agricultural pesticides. Yes, you are the one working with pesticides in your farm. Prolonged exposure could also bring about this problem. Then exposure to industrial chemicals too could as well push you to get this problem. Then the final one is in a situation where you have had repeated inflammation of the prostate gland because of infections, it could also trigger it. In this case, maybe you had urinary infection that brought about inflammation of the prostate gland. You treated it. Not that you treated it badly, you treated it very well. It went. 2 years later, you had similar one that also inflamed the prostate. You treated it. After several exposures, the prostate could become abnormal and then result in prostate cancer. So these are the actual causes or most of the reasons why there is an increase in prostate cancer. So at this point, if you are not yet subscribed to our channel, just hit the subscribe button and make sure that you are subscribed. So if you are liking what we are doing right now, like our post and then share it. Now, you have heard all the things we mentioned, the signs, the causes. Is there anyone that applies to you? Are there signs you're already noticing in your life? Share it in the comment section. Don't be ashamed, just share it. We want to hear if what we are sharing with you, if it's making meaning, if you are benefiting from it, so that others could also learn from it. All right, having seen this, what are the things you could do to prevent this problem? Number one thing you can do is to increase your physical exercise. Physical exercise in that you can target 30 minutes of exercise per day. Yes, it could be whether swimming, whatever, bicycle riding, or just brisk walking. After dinner, you could just do brisk walking for 30 minutes. That would be a great help for you. Number two is to target some considerable weight loss. If you lose weight and you keep yourself within the acceptable BMI, you are likely not to push yourself to it. Yes, your BMI should not be more than 25. If it is possible, keep it about 22. That will be fine. For anything above 25 will not be too fine for you. Obesity is not a good one at all for this problem. Number three is that you should try and eat more vegetables and fruits. Yeah, vegetables and fruit contain a lot of minerals and proteins and other things that could help you to fight against this problem. Yeah, a lot of minerals that can help you. Then the next one is that you should also try and reduce your sugary drinks. Sugary drinks, and also reduce eating late at night. If I stop eating late at night, it's not supposed to be reduced. Just stop eating late at night. It doesn't help. So reduce your sugary food, stop eating late at night, because they alter your metabolic balance and cause a lot of problem in your sugar metabolism and the rest. Finally, see your doctor. If you are already 45 to 50 years, ask for screening. Ask the doctor to do manual check on your prostate, or even the doctor could recommend some tests like the PSA for you, so that they can find out if your prostate is already at risk, if there is anything that is happening within the system. So that is it on prostate cancer. Make sure that you share this with your friend, like our video, subscribe, and always check on our channel whenever we share new videos. See you in my next video. God bless you.